What happens when the people who care for everyone else have nothing left to give? Every day, physician's assistants step into exam rooms ready to solve problems and help others, but behind this, a lot of them are struggling with burnout. What is career burnout? Career burnout is emotional, physical, and mental exhaustion caused by prolonged stress within a workplace. Burnout affects many different professions, but is very prominent within healthcare professions. One of the healthcare professions with rising numbers of burnout experienced is physician's assistants. Physician assistants play a vital role within the healthcare system. They manage demanding patient loads while working in fast paced clinical environments. Within my research, I was able to find what specialties experience the most burnout, specific causes of burnout, and how burnout is closely related to a decline in mental health. Although any type of physician assistant can experience burnout within their specialty, I found that those who had higher death rates were more likely to experience it. This is because patients' death can cause physicians' assistants to feel a sense of failure and a lack of skills, which can get so overwhelming to the point that they don't want to continue with their career. One specific specialty with a very high burnout rate is oncology. Physicians' assistants reported struggling with caring for patients at the end of their life with limited treatment options and feeling inferior to the oncologists who decide the final treatment plan. A study found that 25% of physician assistants have left their position in oncology due to these issues, and 21% of physicians' assistants are planning on leaving. Specific causes of burnout. The first one is emotional exhaustion. A lot of physicians' assistants reported they felt exhausted with their work. Many of those working with critically ill patients responded to them with emotions of their own, causing a sense of failure and frustration when the illness progressed, and sometimes a desire to avoid the patient to escape these feelings. This takes a huge emotional toll, and many are not given resources to prevent these emotions. This can affect the quality of patient care and eventually lead to burnout. Relation to mental health decline. The chronic stress of burnout has been reported to lead to or even worsen previous symptoms of depression, anxiety, and suicidal ideation. When depression and anxiety are already present, they can also affect satisfaction with physician assistants' careers, making burnout more likely. Those with mental health issues are at a higher risk of feeling unsatisfied in their workplace, especially if they are not seeking out help. Mental health decline and burnout go hand in hand. Another cause of burnout is changes in working conditions. Those working in understaffed environments report feeling more pressure to the point they can't obtain quality care and have to work extreme hours, which doesn't allow them to emotionally and physically heal. This can cause prolonged stress, which can overwhelm coping mechanisms, depleting their energy and motivation. You may be wondering how physicians' assistants could prevent burnout. There are numerous ways that I won't touch on, but the ones that I will are focusing on physician assistant and patient dynamics, strengthening communication skills with patients, reflecting on patient care, and self care. Focusing on patient dynamics will help physicians' assistants separate their own emotions and work to create better quality of care and lessen chances of emotional exhaustions. Strengthening communication skills with patients on end of life care specifically is very important and helpful with reducing burnout, as it's shown to lower levels of traumatic stress and higher levels of compassion and satisfaction within their workplace. Physicians' assistants can reflect on patient care within their patient care teams or with support groups, and this can help minimize the perception that they failed and help them correctly process negative emotions they may be feeling. Self care outside of work is also very crucial in preventing burnout. It helps physicians' assistants build resilience through physical health, emotional regulation, and maintains a good work life balance. Overall, working as a PA can take a toll mentally and physically, and it is very important to look out for the signs of burnout, whether you yourself decide to go into this field or know anyone within it. There are resources to get help when needed, and this should be an issue that is talked about more often. PAs play a vital role in patient care teams, and without them, the flow of hospitals and private practices would not be the same. This is a growing issue, and I am hoping it becomes more known so it can be prevented in a better field of work for my future. Thank you for watching.